Hi,
Awesome.
everyone. This is Jenny from Aspire Respiratory Products, and today I have Lisa Cheek here with me. Lisa is a physical therapist, and she reached out to me a few weeks ago to tell me about her experience with the EMST, and we thought that it may be helpful to our audience to share it with everyone in the hopes that it may help somebody else in the future. So, Lisa, thank you so much for being here with me.
Yeah, thank you so much for having me.
Yeah, can you
Um,
introduce yourself a little bit? Tell the audience a little bit more about yourself.
of course, yeah. So, as you said, I'm a physical therapist. I'm in Taos, New Mexico. Right now, I recently opened my own specialty practice here in Taos, Wise Ones Physio. But how I got here is kind of a long story. And I probably wouldn't be here had I not been affected by COVID-19. And of course, the EMST was a big part of my recovery from COVID. And that's why when I saw the EMST now being used specifically for recovery in COVID-19, it really, when I reached out to you, I said it like brought tears to my eyes because when I was using it, it was kind of a, well, just try this and see if it works. And now to see that it's actually being used intentionally in this way, and there's research behind it now, it was, it just shows me how far we've come in such a long time. So back to, kind of how I got here. I specialize in pelvic health, lymphedema, oncology, and kind of complex patient management. But in Taos, New Mexico, it's a rural area, and I was working in a hospital-based outpatient clinic. So you see kind of all of everything. And I was working here starting in the end of 2019. And of course, then when COVID hit in 2020, everything sort of changed for everyone. But because we were a rural hospital system, we never stopped working. We just kept on going because our system, we are everything to everyone. And so I worked with patients with COVID in our acute care units at our critical access hospital. We worked with patients, all through 2020, 2021. And I never got sick. We worked sometimes without PPE, sometimes with, the whole, capper hood, full PPE. And of course, in my personal life, I was very, very careful too, because I have a young child at home. And so followed every precaution, never got sick for 2 years. And, of course, came to have a great deal of confidence in personal protective equipment. And then in 2022, I did get sick. I caught the Delta variant of COVID-19 on the job. Not in patient care, actually. I caught it in the break room of all places. Woke up one morning with a sore throat and went to employee health to get tested, and I never got to go back to work. And my whole life just was upended one day. And so I got pretty sick with COVID, was never hospitalized. I did get to manage at home, but I did, have some pretty severe complications. One of which was I got fluid in my lungs. And then I got the post-acute sequelae of COVID that we now talk about as long COVID. And it's funny to think that back in early 2022, it felt like the dark ages still of COVID and long COVID. Paxlovid wasn't on the market yet. And we were really just starting to talk about long COVID, in the medical community. Luckily, I had very good physicians that identified my long post-COVID issues right away: dysautonomia, tachycardia, or inappropriate sinus tachycardia, and sort of the whole gamut of issues that come with that. And so, I had good diagnostics, but as far as treatment for these issues, there really wasn't a lot. And so I was pretty much bedbound for a year and a half. COVID, I was 34 and I had a 2-year-old kid. Right. And so I went from being this incredibly busy practitioner in rural health, like I said, being everything to everyone, a working mom. I was really healthy, had kind of minimal health issues up until then, to being flat on my back. And it was just devastating. And so one of the main issues that I had early on was that I was getting extremely short of breath and I couldn't speak for any period of time. And I know I sent you a video of kind of in my early stages, my voice changed significantly. It got so deep and gravelly, and I would speak for maybe a minute or two at a time, and I would become so faint, so dizzy. And I felt like just not being able to speak was so traumatic for me, because that, in my work, that was a big thing. And also just, having a toddler, how do you have a toddler and not talk to them? And so I reached out to a friend of mine who's a speech language pathologist at my same rural health system. And she said, well, there's not a lot researched, but have you heard of this little device? Why don't you get one? And, here's, just follow the instructions, basically. I was like, okay, I'll get it. And the first time I used it, I nearly passed out. It was so difficult. And so I actually took it to my physical therapist, who I was seeing, a colleague of mine, and we had to figure out how to dose it together, and monitor my vitals, because I also have postural orthostatic tachycardia, and it was affecting my vitals so much that it was making me syncopal. So I had to use it on the lowest resistance, and I could do maybe 3 repetitions of that expiratory training.
Yeah, and I think that's such an important point. And to just interject there, because a lot of people are like, well, what is the protocol? I'm like, well, okay, we have a general protocol, but it is really important to work with your healthcare provider to figure out what's okay for you, because it's really not going to be, it's not one size fits all, right?
Exactly. And so I could do maybe 3 repetitions, and then I would have to spread that out over the entire day. And I did that for several months. And eventually my voice built back up, and my ability to, speak for more than, a minute or two built back up. And literally my ability to breathe came back, and I was doing that in conjunction with medications and, other things that various physicians were telling me to do. And I will say that of all my post-acute COVID issues, I just had pulmonary function testing done, I want to say a few months ago, and that is like the one thing that has come back perfect.
That's amazing.
That's like pretty much the only thing that's recovered is my pulmonary function. Like everything else is still out to lunch, and I'm kind of just learning to live with it. But like that is like the one thing that I have worked with consistently, and it came back. Yeah. And, so now, like I said, I was bedbound for a year and a half. And that's a lot when you're my age and kind of type A and driven. And, I spent a lot of time thinking, and it's like, this is not my story. I'm not retiring at 36.
Exactly. Well, thank you so much for sharing your story with us, Lisa. We really appreciate it. I hope we're able to help some others who are listening in. Did you want to share any contact information?
Yes, of course. You can go visit my website, www.wiseonesphysio.com. I'm on Instagram. My handle is Wise Ones Physio, Facebook, Wise Ones Physio Taos, TAOS is how you spell that. And yeah, hopefully I will have some on-demand video content for people who are not in New Mexico. And yeah, I just hope to keep growing and keep sharing, because I think the experience of, having this chronic disability myself just makes me a better physical therapist every single day. So.